clinicians face two main challenges in vaccinating adults. First, staying up to date on new vaccines and recommendations. And second, overcoming systemic barriers to increasing vaccination rates. Hello, I'm Paul Hunter, MD. I'm an associate professor of family medicine and community health at the University of Wisconsin-Madison. I also serve as the associate medical director of the City of Milwaukee Health Department. Finally, I'm a voting member of the Advisory Committee on Immunization Practices, or ACIP, of the United States Centers for Disease Control and Prevention, or CDC. My co-authors, Sandra Freihofer, MD, and Peter Szilagyi, MD, MPH, and I wrote the article in the Mayo Clinic Proceedings titled Vaccination of Adults in General Medical Practice. In our article, we highlight recent and potential upcoming changes in immunization recommendations for pneumococcal, HPV, zoster, and other vaccines. Vaccinating children with PCV13 indirectly prevents much of the pneumococcal disease in adults via herd immunity because of significantly more efficacy and longer duration of immunity against zoster cutaneous eruptions and post-herpetic neuralgia. The ACIP preferentially recommends recombinant zoster vaccine, RZV, over zoster vaccine live, including expanding the starting age from 60 down to 50 years old. To address this first type of challenge to vaccinating adults, keeping up with changes in vaccination recommendations, such as the ones above, clinicians can use mobile apps, ACIP web pages, and other resources that we list in a table in our article. To address the second challenge, systemic barriers to increasing vaccination rates, clinicians can advocate within their health systems for implementing the CDC's 4 standards for adult immunization practice. First, assess adults' vaccination status at every clinical encounter. Second, strongly recommend needed vaccines. Third, administer the recommended vaccines. And finally, document the vaccines administered in the state immunization registry. Clinicians' roles in implementing the 4 standards include writing the standing orders and advocating for nurses and medical assistants to receive training and protected time for assessing vaccination histories and administering the vaccines. Until the next review of adult vaccines in general medical practice appears in the Mayo Clinic Proceedings, clinicians can use the resources and standards outlined in our article to stay up to date on new vaccines and recommendations, and to overcome systemic barriers to increasing vaccination rates. Thanks for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.